So I see an anatomic disease. We take the results of that test and we get a score, and it's called an Agatston score. 0 to 1,000. 0 being clean pipes. 1,000, we got a problem.
I'm in trouble.
Yeah, Houston, we got a problem.
Yeah.
So we'll do that, and then we're going to sit down and I'll show you what your score is. And you'll also have anatomical proof of lack or presence of disease. I don't mind sharing myself. When I was at NASA and I was an aviator, I had to get the same test they did. So when I was 40, I got my coronary artery calcium score.
Okay.
I think that is what Mr. Swift received. We put all of this together, and then I'll tell you your exact risk, but I'll actually show you. Now, from what I understand, for her father, he had to have 5-vessel bypass. So he had serious disease everywhere. What we want to do is we want to catch it before we get to where Mr. Swift was.
Certainly.
The EKGs can't do justice. It's part of the puzzle. It's part of the piece of the analysis. So let me explain the calculator. It's called AstroCHARM. It was an algorithm we developed with all these cardiologists and specialists. And we then had it validated by the National Institute of Health and a specific group called NSBRI. NASA loves acronyms. So that's just a long title for a very special group of physicians. I can show you the anatomical disease or lack thereof. But if you do have disease, let's treat it. Let's keep you from getting the 5-vessel bypass.
Yes.
And we can do that and more.
So your approach here at MiraBelle Aesthetics and Wellness is to really get in front of disease, to be more proactive. My guess is the younger you start looking at your overall health and really grabbing multiple data points, the better the odds are of living a very long and healthy, active life.
Yes, yes. Part of the AstroCHARM includes some questions. Besides blood work, CAT scans, I need to know your age. I need to know your ethnicity. I need to know if you're a smoker. Are you diabetic? Do you have high blood pressure? Do you treat it? These questions guide me into where I need to start in stratifying your risk. History and physical, along with the questions involved in the AstroCHARM calculator, I get a risk of where you are before we go any further. If you have all of those positive, I'm going to tell you got a problem. And we're going to start treating it immediately.
Sure.
We're still going to continue, but you may be 40 and you have all those risk factors. Oh, your family history is also important. Let's say you tell me that your father passed away at 45.
57.
Okay. And you're?
59.
Okay.
Heavy smoker.
Okay. We'll take that all into consideration. But my pre-test probability of you having disease is medium to slightly high.
So your antennas go up when you hear family history.
Yes.
Obviously, as a child, I was exposed to secondhand smoke.
Yes.
So those factors all play in.
They all play in.
Okay.
Risk stratification has been validated by the NIH and NSBRI, like I said, to allow astronauts to be healthy enough to go into a austere environment. It's now available for terrestrial individuals. We all live in an environment that at times can be austere.
Yeah.
So the key is knowing you have disease or not. If you don't, we still prevent you from getting disease. If you do have disease, at what level is that disease? And then at what level of that disease determines your treatment. Or if you're perfectly healthy, maybe it's just a surveillance. So it doesn't end with the test. It's just the start. Say everything shows serious disease. That's got to be addressed. So if everything comes back positive, I need to refer you to cardiologist. So if I refer you to a consultant, you're getting the best of care. So.
How does someone schedule an appointment with you if they have concern or they just want to get in front of things, understand kind of their health today, and then continually monitoring it? Do they just call into MiraBelle Aesthetics and Wellness in Lakeway, Texas, or?
We're one call away.
One call away.
We'll get you the answers as fast as possible.
And you can pretty much provide someone with the same level of care that you provided for astronauts, which is really equivalent to what many people hear about as executive physicals, where they pay, $30,000 for this comprehensive physical. You can do that for a much, much lower rate and really achieve a similar result.
When I retired from NASA, I wanted to continue what I did there, and that is be a preventive medicine doctor. Yes, we can offer you the care that I provided the astronauts, maybe even a little bit more.
Oh, wow.
But we can take care of you, and we can prevent your disease. And if you got the disease, we can treat it.
Great. Thank you.
Love to have you come in.
Thank you.